Mobile Crisis is a team that goes out into the community and meets individuals where they are having their mental health crisis. We assess, evaluate, and de-escalate when possible on scene. We have a crisis stabilization unit where people can go and deal with their symptoms of mental illness. We have outpatient services at Hinds Behavioral Health that are also offered to these individuals. And sometimes, if we deem the person is a harm to himself or others, hospitalization may be required, and we also can assist the person with that also. You do not have to have a mental health diagnosis in order for us to come to your location. If you're having a mental health crisis, we're available. We have a team of peer support, case management, and therapists. One of each goes out on each crisis. We also have CIT officers who are police officers trained in mental health. They go through a 40-hour class, and so they recognize the symptoms of mental health and they help us on scene when we call for assistance. Mobile Crisis is available 24/7 every day of the year. It doesn't matter. People's crises don't happen between 8 and 5. So we're available to the Hinds County community 24/7. Hinds Behavioral Health Services has a mobile crisis line that's 24/7. We also now have the 988 number, which is the 911 for mental health crisis. We get dispatched through the 988 to our catchment area, and we respond to those crisis calls coming in from our new 988. Families can request a CIT officer. Then when he gets on scene, if he thinks that we need to come assess, they'll give us a call and we will meet them on scene and assess the individual, and we decide at that point what we need to do. We can come to where the individual is experiencing the mental health crisis. We can assist that individual with starting up services at Hinds Behavioral Health or our crisis stabilization unit, if need be, hospitalization. What we do not do, we do not provide transportation for the individual. If they have to be transported somewhere, we ask a family member or AMR if they're going to a hospital. We do not bring medicine with us. We do not have a nurse with us. It's simply a therapist, master's level therapist, a case manager, and a peer support. We do not get involved in domestic disputes. It's just mental health crisis. And so when we assess the situation and it becomes apparent that it's a domestic situation, we recommend that they call 911. It's a really unique program where we get to go into the community where the people are. We meet them where they're at, and we help provide services that quickly to get them help immediately. And the turnaround is that you get to see that individual go from their lowest point where they have no hope to a point where they are productive citizens in their own community again, and the transformation is remarkable.